Here to talk about signs your body may be telling you that something more serious is wrong is Dr. Shoba. Dr. Shoba, we were just talking about how legs can sometimes be a warning sign to people that there may be a heart issue going on.
Absolutely.
So tell me a little bit about leg pains, and there's different kinds of leg pains and what that can mean ultimately.
Oh, yeah. Leg pain can be something very benign. You know, even children have growing pains. You know, you may heard of your grandparents say they've got Charlie horses, you know, muscle cramps that wake them up. And you may have shin splints, and sometimes yourself, you know, you're exercising too much, or you've got sprains, you've got pinched nerves in the back that go down the leg. Now that can be somewhat dangerous too. But there are certain circulation problems that can actually be extremely dangerous and can sometimes be a marker that you have heart disease and you are at risk for heart attacks. You know, we have got arteries in the legs and we have got veins in the legs. When you have a blood clot in the vein in the leg, for example, you've been sitting around flying for a long time, traveling for a long time, you can develop a blood clot in the leg and that can go to the lungs and you can die from that. And you know, that can present as leg pain. There is a condition called peripheral arterial disease, PAD. Peripheral artery disease, where the circulation or the arteries that go to the legs become very diseased. They've got cholesterol, they're very narrow, and you have a lot of leg pain, and you may blame it off on arthritis. Every time you walk, you have hip pain and knee pain and leg pain, and you think it's arthritis when it's actually circulation trouble in the legs. And sometimes that can lead to amputation, and that is so sad. You develop ulcers in the legs, and it can lead to amputation. However, if you have PAD, the highest risk, you have an extremely high risk of dying from a heart attack, actually, because the same pathology that causes the PAD in your legs causes the arteries in your heart to have blockages.
Wow, interesting. And that was one thing that you were just telling me too, is that sometimes people will come in complaining of leg pains and then you check out their heart and you can tell there's a blockage.
Absolutely.
Wow.
And so it is very important that when you have pain in the legs, you determine whether it's the more serious kind or the more benign kind and get it checked out. Simple things like, you know, low potassium. If you're on fluid pills, you have low potassium, that can cause a lot of leg cramps. Magnesium, if it's low, your vitamin D is low, or you're dehydrated. You know, some of those things will also cause leg pain. But if you have PAD in the legs, and there's a simple test, you can do a procedure called ABI, where they put blood pressure cuffs on the legs and check the pressure in the legs.
Wow.
It's a simple test, and they compare it with pressure in your arms, and if there is a difference, we know that you have PAD. And of course, just feeling the pulses in your legs gives your clinician an idea that you've got circulation trouble.
Right, and it's better to just be safe than sorry, to come in and see the doctor, and even if it does turn out to be something small and not something that could result in a blood clot or PAD, but at least you're getting it checked out.
Yeah, diabetics especially, they blame it off on neuropathy. They have numbness and tingling, but they could also have PAD, and they are at very high risk for heart attacks.
Right.
So please get checked out if you have leg pain.
Right.
Don't ignore your symptoms.
Right, and so then let's talk about the treatment aspect of it. So if you come into the doctor, you know, you're complaining of leg pains, maybe it is determined that you have a blood clot or you have PAD, what's the next step?
Oh, if it's a blood clot, then you get immediate attention. You have to be on blood thinners and you figure out why you have the clots. And if it's PAD, there's a whole set of treatment for it. Of course, diet and exercise are the key to prevention of any kind of disease in our bodies. Diet and exercise and a positive attitude. I cannot say that enough.
So definitely diet and exercise, and then with the blood clots especially, you know, you mentioned that's when you're sitting down a lot. You're not moving a lot.
Right.
So just doing some sort of physical activity can really help with that.
Absolutely.
Yeah, and so we talked about the preventative measures, but also I think one thing that we always talk about, and I think it's so important for everyone to know, is to also listen to your body, right?
Right. If your body's telling you something's wrong, something is wrong, just don't brush it off. Oh, I'm just getting old, I'm getting tired, I've got arthritis. Just don't brush it off, please.
And so if people were to take one thing from this conversation and never thought that you could equate leg pain to something having, you know, being wrong with your heart, what would you want people to take away from this conversation?
I think getting a regular physical checkup and talking to your primary care doctor or your nurse practitioner or whoever it is to get yourself checked out if you're having this leg pain that is not relieving easily. very, very important.
And so some symptoms too, because we mentioned about, you know, some superficial leg pain that maybe are not a big deal, but then also the more serious leg pain as well.
That's right. If you have, for example, you see that your legs are getting very shiny or having some hair loss, that could be actually a sign of circulation trouble in the legs. If you're getting swelling in the legs, there is bluish discoloration, you know, it hurts when you press on. There are certain conditions that you have to look for and watch for, and if it's not getting better, if it's actually getting worse, then please get yourself checked out.
Yeah, just make an appointment.
And even a
with your
Baker
doctor.
cyst, ruptured Baker cyst in the back of your, you know, you develop a sudden bulge in the back of your calf muscle. You don't want to ignore certain things like that.
Right, pay attention to your body.
Pay attention to your body.
Once again, going back to the golden rule, right? Listen to your body, pay attention to your body. Well, Dr. Shoba, thank you so much. We really appreciate all the information and advice that you're giving us here on Daytime. We always appreciate you coming in as well. Thank you so much.
Thank you.
For more information about being heart healthy, just visit the website on your screen.